Hi everyone, my name's Jules Tushausen. I'm a speech pathologist of 16 years. These are some tips that I wish all parents knew about early childhood early intervention, or ECEI, which is a derivative of the NDIS. What I'd love parents to understand is that there is funding there available if your child is having significant needs in the areas of talking, walking, drinking, communicating, using their fine motor skills, using their gross motor skills like balance, being able to help get dressed, toilet train, and be able to play and participate. So this ECEI is available for children 0 to 6 years of age who don't have a diagnosis necessarily and who are needing those supports. The most obvious support system observable at that age is when talking is delayed or coming later. So if your child is 2 years of age and doesn't have at least 50 words, they are being highlighted as someone who will need support with communication. So with ECEI, you can self-refer. Just Google ECEI and your local suburb, and you'll find a local area coordinator who can go through a phone call with you and help get you set up on the process of potentially getting a package where you can use that money with a speech pathologist or an occupational therapist. So I really urge families to make the most of our government here supporting early intervention, which is 0 to 6 years. What I do see sometimes, or quite often, is parents will wait till school where a teacher will highlight some difficulties or differences that that child is struggling with, the same difficulties that they would have at 1, 2, 3, and 4, but maybe just not as evident. So anyways, when they're at school, they're usually around 6 years of age and they're kind of outside, well, they are outside of that ECEI. So start your process early, and I really want to support parents to advocate for yourself and your child. If your educators or family members or the director at the preschool is saying don't worry or let's just wait and see, we strongly advise that you don't. So every speech pathologist or allied health professional who is working in the early childhood space with children 0 to 6 knows that that is an outdated recommendation. So please don't wait. Get in touch with your community health. You can Google that and there'll be a phone number, and also get in touch with ECEI. There is nothing shameful about accepting help or accepting funding for your child. I've never heard of anyone who has regretted it. It's not means tested. You will never have to pay the money back, and it's for a 12-month period. So you have autonomy to use those funds where you see fit, and if you don't use them, they simply go back into ECEI. If you do have any questions, let me know, but I just would love you to share this with a family member or an educator who could really value or really learn more about ECEI and how it is supporting so many young children and families. If you have any questions, keep asking me. I'm happy to answer them.